Everyone.
With different types of expense policies.
Hello. Thank you all for joining us today.
Budget. Any employee that has
All
access.
right, I'm going to ask all of the participants to go on mute for us. So that way we can make sure we can hear all of the content that's being presented today. We still have attendees that are flowing in right now. So good to see some familiar faces and some new faces with us here today. All right, so I will dive right in. Welcome to CalAIM Links, the CalAIM Links Statewide Best Practices session. My name is Alexis Taylor. I'll be one of your facilitators today alongside our friends at JSI. I'm a senior program manager here at HealthBegins, and at HealthBegins, we are a national mission-driven consulting and training firm, and it's our goal to help healthcare and community partners improve the social and structural drivers of health equity for both patients and communities. And if we go to the next slide, I'd like to let everyone know that this session is being recorded, so please smile for the cameras. If you are comfortable, please feel more than free to come on camera for us. We're going to have some really cool breakout sessions later on, so we'd love to really engage one another, not just as facilitators, but as peers in this space in this session as well. And if we go to the next slide, once again, before diving in, I just want to take a moment to tell everyone, thank you so much for joining us today. We understand that in the space of CalAIM, everyone is incredibly inundated. There are so many moving parts, so many complexities, so many relationships.
Bless you.
I heard someone say bless you. All right, just a reminder for everyone, if we could all go on mute, that would be super helpful, just so we can make sure we can hear all of the content being presented today. That was funny. But yeah, just to reemphasize what I was just saying, we know that everyone is over capacity right now. So although this information is incredibly important, we know that you're taking time out of your already busy day on a Friday to make sure that you can network and just receive this TA today with us. So we just really appreciate and value your time. And if we move on to the next slide to kick things off, we like to ask everyone to update your Zoom names. Please include your pronouns, the name of your organization. As I mentioned earlier, we want this session to be incredibly collaborative. So knowing who's in the room is really going to help us set the tone for today's call. Second, we are going to pose an icebreaker in the chat for you. Please let us know what you are hoping to take away from today's session. Although we have this content that has been pre-designed as a response to a lot of feedback that we have received from managed care plans, from plan partners, from project partners, from providers themselves, from evaluators. We still want to know how to pace the content to make sure that we're reacting to the needs of the participants. So please, after you update your Zoom name, include your pronouns and your organization, go ahead and just toss in the chat for us what you're expecting to take away from today's session. We know that everyone comes to CalAIM sessions with different expectations, so we'd like to just make sure we're tailoring it to what your needs are. Lastly, we want to remind you that you have the Q&A or the chat function available for you. So if you have questions, please feel more than free. Toss those questions in there, chat with one another. We are so big on encouraging that collaboration and that networking that takes place. We have seen participants in past sessions exchanging information, sharing links to various websites. Please feel more than free to, advance that process, network, and make sure that you're connecting with one another. And then just as another reminder for everyone to make sure that we are all on mute. And I will also ask for some support from my co-moderators today to help me with just muting some of the participants that just might accidentally be unmuted right now. And if everyone could also just take a quick sec just to look at the microphone at the bottom of your screens, just to make sure that it is crossed out so we don't hear any of the background noise. We would so greatly appreciate it. All right, all of that being said, please don't forget to let us know what you're hoping to learn from this session in the chat. And if we go to the next slide, I'd love to take an opportunity to just extend a very special thank you to our project partners. CalAIM Links is a collaboration of Transform Health, Aurrera Health Group, and HealthBegins, and we are being generously funded by the California Healthcare Foundation. To learn more about any of our partners, we are going to drop a link to today's content inside of inside of the chat, not at this moment. We'll update that link later for you. Yes, before today's session, we'll make sure that we get an updated link to the content for you inside of the chat for you. And Melissa, I'll make sure I drop the updated link for you so that way we can have access to that. And so if we go to the next slide, as I mentioned, this session and CalAIM Links is being generously funded by the California Healthcare Foundation. And so we'd like to extend a very special thank you to Carlina Hansen, who is our program officer from CHCF. Carlina is not on the line with us today, but of course would like to extend so many thanks for all of you that are joining us.
I'm far from everything.
Oh, and sorry, we're having like mute malfunctions today. And so, yeah, just extending that very special thank you to Carlina Hansen from CHCF. Carlina has invested just an incredible amount of knowledge and resources into making this work possible and just making sure that we're supporting providers the way that they need to be supported. That being said, before we dive into our objectives for today's session, I just wanted to go to the next slide to provide a little bit of background as to how we got here. What is CalAIM Links? You know, how did this initiative get developed? And so to provide some context, we've included this background slide. And so in 2021, we piloted a technical assistance program in response to just a very strong need for CBO and provider contracting support and guidance. And so taking all of those lessons from that body of work, we were able to develop those lessons into a new program plan in 2022 entitled CalAIM Links. And our goals for this work is to make sure that we're building impactful CBO and MCP relationships by facilitating learning and community building, to make sure that we are strengthening the statewide capacity amongst providers, and to make sure that we are advancing equity by recruiting CBOs that serve historically marginalized communities and populations. To date, we've hosted over 25 sessions that have provided TA to approximately 1,200 participants. And all of that content is going to be available at healthbegins.org/CalAIM. And so throughout this session, you'll hear me reference a few videos that will be incredibly helpful to just further illuminate the content that we're going to cover today. That being said, the objective for today's conversation, if we go to the next slide, is for everyone to understand the best practices that will aid providers in navigating the CalAIM contracting process with a managed care plan. We've heard a lot of feedback that contracting is overwhelming, the language can be confusing, there's not really a clear step-by-step process. And so over the past year, we have been working with our plan partners just to make sure that we are translating the DHCS language and translating the plan requirements into something that is very digestible for providers to take in, to understand not only how to contract, but what their funding opportunities are and how they can overcome challenges by using something like a platform or this medium of best practices to overcome issues that other CBOs have already uplifted. So just really trying to truncate all of those lessons into just 5 very straightforward, direct best practices that you can use to apply them in real time and to put those into practice. And so to accomplish that, I'd like to go over today's agenda. So if we go to the next slide, we have broken today's content down into 3 parts. So during the first part, we are so fortunate to have Emma Gear of JSI, who will facilitate a conversation between HealthNet and Champions Recovery to entail how they worked to forge a relationship that led to a successful contract implementation. Part 2 is going to cover the actual best practices that we have developed. Those best practices include assessing your organization's readiness, determining your contracting pathways, how you can specifically leverage funding to build capacity, utilizing the non-binding pricing guidance that DHCS has established, and building relationships with peers and plans to bring it all full circle. And then finally, at about 30 minutes before the end of this session, we're going to separate into some breakout rooms so that way we can uplift some reflections, respond to questions, make sure that we give everyone an opportunity to network with one another. And those breakout rooms are going to be broken into 2 different sections. Group A is going to be that CalAIM curious group. Like we're, still trying to, check out CalAIM, understand if this fits into our strategic priorities, determine how it could. Not really sure if we're going to contract yet, but we want to know more. So we have questions that are really more so in that curious phase of investigation. Whereas for Group B, those are the providers that have decided to contract no matter where you are in that contracting phase. You've made the decision to move forward. You might be, reaching negotiations pretty soon, and you're just trying to make sure that you are leveraging those best practices to successfully close that contract. All right, so that is our agenda for today. That being said, I'm so excited for us to go to the first part of today's conversation, which is going to be building powerful relationships. And as I noted, Emma is going to facilitate this conversation with HealthNet and a few of our partners over at Champions. Emma, I will gladly pass it over to you.
Wonderful. Thank you so much, Alexis. I'm delighted to be here with all of you today. Thank you so much for joining us on a Friday afternoon, right before a long weekend. We really appreciate your presence. My name is Emma Geer. As Alexis said, I am with JSI Research and Training Institute. We are a public health research and consulting organization. And we have also been absolutely delighted to be supported by the California Healthcare Foundation over the last 9 months to a year or so to really have the opportunity to uplift CBO voice during these early stages of CalAIM implementation. So one thing that we have done as a part of that process is we have conducted a series of interviews with CBO representatives across the state to better understand their experiences when they've partnered or attempted to partner with MCPs, and then elevated this feedback back to DHCS. Now, all that being said, I'm absolutely delighted to be here today with our lovely panelists. They are the experts in the room today. We have Isabel Rivera from CalViva HealthNet, and we have Anthony Moreno, Brenda Zavala from Champions Recovery. Thank you so much for joining us. So we're going to go ahead and dive into our panel. Let's get started. So I would love for each of you to go ahead and introduce yourselves a little bit more fully. Anthony, why don't we start with you? Tell us about your role as program manager for CalAIM services at Champions Recovery.
Yeah. So again, my name is Anthony Moreno. So thank you guys for having us. So my role is CalAIM, everything CalAIM. So I'm the CalAIM program manager. I'm in charge of hiring navigators, lead care managers, help with contracts, applying for grants, and any new services we plan on providing, like suburban centers, things like that will be under my leadership there. So everything CalAIM, it's all me.
Great. Thank you so much, Anthony. Brenda, if it's okay, I'm going to pass it off to you to introduce yourself as lead care manager for ECM at Champions. Tell us a little bit about your role, what population you serve, and the types of services that you all provide. It looks like Brenda turned off her video momentarily. So Isabel, why don't we pop over to you? Isabel is the community relations representative for CalViva HealthNet. Tell us about your role and what the community relations team does to build the ECM and community supports network.
Hi, thank you so much for having me. Happy to be here. Yes, I'm the community relations representative under community engagement. So we are the boots on the ground. We are the community facing team, and we are engaging out in the community with stakeholders, building partnerships. So when the implementation of CalAIM, we heard about that, we're really excited to just be able to identify those relationships that we have established throughout the time, and knowing that now with CalAIM and both programs that they can get reimbursement for the work that they've been doing. They are the subject matter experts in these types of work. And so it was really exciting to bring this information to all these partnerships that we've had, you know, and part of the community engagement was just being able to do an overall geographic analysis of who our providers and partners are. Where are we going to, how are we going to outreach to them? So that's how we began. We did a strategic outreach to these partners that we identified that could fit perfectly for community supports, and reached out and started engaging with them and getting them excited about CalAIM.
Awesome. Thank you so much, Isabel. I love what you said about folks in the community and the CBOs being really the experts. I know we got some claps from the audience for that. Let's go ahead and talk about your relationship, CalViva Health, HealthNet, and Champions. How did you all start the relationship? And what did that kind of process look like for you all?
Well, we started with identifying these partners out in the community. Kings County, my service area is Fresno, Kings, and Madera. And for those folks that are outside of this area, it's Central Valley. So that is my service area. So we identified some providers in Kings County. They were the phase 1 county. So we just struck gold when we identified Champions to be one of those providers, and they were so on board. You're going to hear their story. They have so much passion, and that's what we were looking for. You know, they are the experts in the work that they do, and now we as managed care plans are able to reimburse them and build that community, that service to our members. So we that's how we started. We identified those partners in Kings County first, and then later on we started doing this identification of our partners in Fresno and Madera. But with Champions, it was great. I mean, I know we had some growing pains along the way with anything new, CalAIM. But we have, I think, solidified this relationship. We've learned from each other. We heard what our partners, CalAIM providers needed and wanted, and we'll get to share a little bit more about that. But I'll go ahead and let Anthony know. I mean, I'm excited about the relationship we have, so let him say what he thinks.
Yeah, thank you, Isabel, for that. So I always appreciate your praise. I don't know if I deserve all of it. It's very awesome, the things you say. So I'm always trying every day to improve our program. But for our relationship building, just a quick backstory. There's a lot of relationship building before I started January 2022 with our executive director, Frank Ruiz. Unfortunately, he's not able to join the call today. He has a family meeting. So he met with a member that was part of Kings County Behavioral Health here locally. She was an alcohol and drug program manager, and she connected Frank to HMA, which was healthmanagement.com. And at the time, this is before CalAIM started in January of last year, there was a lot of networking, kind of like what we're doing today. And so he learned by joining with HMA, by meeting with Isabel and our point of contacts, how to apply for the contracts, what's the best routes. And so he attended a lot of webinars, a lot of trainings. And then when I joined in January, kind of late to the show, I started January 3rd and CalAIM launched January 1st. And so I was learning on the fly. So I spent a lot of time reading everything that was available to me with DHCS from the managed care plans. And then finally meeting Isabel and her awesome team. So just from day one, you know, reading and then meeting with Isabel and her team, they were able to help, you know, put 1 and 2 together. So I had a really good understanding of what we were doing. But that's really how our relationship started. And then throughout all last year, they've just been there every moment, available to help when I needed it, whether it's through email or phone call, and then meeting at different collaboratives in Fresno areas. And so they've been really helpful with our story.
Thank you, Anthony. Yeah, so we continue our relationship building just by, you know, providing any trainings that are available early on. You know, if there was step-by-step walkthrough of a certain topic, we would go ahead and either get on a call one-on-one. We definitely want to get to know our providers at a deeper level, want to get to know their process flow. How are they reaching our members? How is that looking? So just getting a better understanding of that. And we can't get that unless we meet and form those relationships. So we definitely did that. Heard what they were needing, and we started having office hours for our providers, you know, identifying where is it that they're having any barriers, challenges. And if it was, for example, claims, we would bring somebody from the claims department, have a full office hours to address those issues. And I really think that really has helped our CBOs along the way.
Yeah, and Emma, when it comes to claims, that's always been, I've made it clear with Isabel and her team, that's always been probably the most difficult process for us. Out of everything that CalAIM is, I'm new to medical billing. And so learning that on top of CalAIM itself was really difficult. But I tried sending a few claims myself, learning as we went. But then when I kept running into walls, I reached out to Isabel and her team, and they were able to provide very concise information. And then further, they met with me in a one-on-one meeting to go line by line over the claims process. And they weren't able to tell me exactly which codes to use, but sending me in the right direction, saying, hey, it should be a group of these, find the ones that match your service. And then from there, sending one claim with their support, and then just testing it out, sending it through the portal system. And then the following morning, someone from her team was able to check it on their own services, reach back out to me and let me know, hey, green light, it got approved. So all the struggles I was having, it's very natural to go and try to figure out yourself. But once you went into some walls and I reached out for help, they were there available. So I really appreciated that at that time.
Thank you both so much for sharing. I'm hearing a lot of things that are coming out, simple things like having weekly meetings, but also hosting office hours and really bringing in other departments like claims and authorization to really support you all in this challenging and complex and new process. So thank you both so much for sharing.
And if I may add, Emma, we
Sure,
didn't get an opportunity to do this early on with Anthony, but we realized that, and it was mentioned earlier, one of the challenges was just going through this certification application. So what we're doing now is what we've done is now we bring in the subject matter expert, our subject matter expert on housing, for example, and we go and do a deep dive on the certification application. So that way the interested community partner CBO that is interested in that community support service knows and identifies what supporting documents are required to get them through the process of the certification application. Same thing with ECM providers. If they're interested, we have a whole team, delegation oversight. They know what they're looking for in these certification applications. So we bring them in, have a one-on-one discussion. Prior to that, although rewind, we do an overview of CalAIM 101. What is CalAIM? What is community support? Each of them, there's 14 of them. How that fits their agency, the organization, and then we move forward from there.
Thank you so much for sharing that, Isabel. And it's very clear that you all have shifted your processes to meet the need of future CBOs who are interested in contracting with you. I'm going to shift just a little bit, and this is more directed towards Anthony and Brenda, but Isabel, please feel free to jump in if you have any response. I'm really curious about what outreach to members has looked like, and if you've faced any challenges in this regard. We've heard from some CBOs about concerns of, well, I'm not going to get paid for outreach. And that's going to create fiscal challenges for our organization. So can you tell us a little bit about what has outreach looked like for you at Champions?
Yeah, of course. It's a great question, and it's definitely something that is warranted. So outreach looks like, when we talk about outreach, we should talk about two separate programs, ECM, Enhanced Care Management, and Housing Navigation. So when we talk about not having the ability to reimburse, with ECM, it comes in the program. So if you're, when we started, I can use my example. On day one, we had 100 referrals given to us for ECM. So for all of them, they all had a reimbursement, a subsidy tied to it. So your guys's might be different than ours. And so that was reimbursable. So we just had to claim that we did try outreach on all 100 people, whether the addresses are there, whether they're homeless, we went and tried to find them. So there is funding for outreach. Now for housing navigation, at this time for our program, there are no funding sources for that. But once you get the ball rolling on outreach and you have a really good system, to me, it's very easy to enroll in a member once you have that down, and you can easily start billing right away. So in both programs, they have their own differences with referrals, but what it looks like for us is we go out in the community. Part of CalAIM itself in the slogan is meet them where they are, the members. And so we try to meet them essentially where they are, whether it's encampments, street outreach, at the parks, libraries, transitional shelters. So we go out weekly, if not daily. And so on top of that, I think it's really important to connect to your local continuum of care in your region. And so for us, it's King's Tulare Homeless Alliance. And so they are fantastic in our community. We attend all of their committee meetings and collaboration meetings. And so they have an assigned housing navigator to our in Kings County. So we meet with her and she's absolutely amazing. So by connecting with your local continuum of care at the same time with your local resources for us, like Salvation Army, different churches, the local health and human services departments. And so you want to find a way to bridge the gap with your resources and especially with your outreach. So that's been really helpful for us to connect with all these different parties and trying to locate where these individuals are.
Thanks so much, Anthony. Brenda, I want to turn to you. There's been a little bit of a concern from some CBOs that they are concerned that they will not necessarily be able to stay true to their mission as they're delivering services. Can you speak a little bit to how potentially you have been able to maintain the services in the way that you want them to be delivered and stay true to your mission while working within the confines of CalAIM and in a contracted relationship with HealthNet? You're on mute, Brenda. Anthony, do you want to go ahead and take this one if Brenda is having some tech difficulties?
Yeah, sure. So I can start with real quick our mission. So our submission is very short: renewing hope, restoring lives. And our longer mission is in partnership with our community, Champions provides compassionate, supportive services to foster hope and healing for individuals and families overcoming addiction, mental health, and social barriers. We provide a plethora of different services here at Champions. And so historically, we were known for substance abuse services. And we have outpatient, inpatient services. And we have a whole bunch of range of services to empower those, like parenting and interpersonal violence. And so our mission is very deep in the community. We want to try to engage the person with wraparound services. And so with CalAIM, it really allows us to be even truer to our mission. And so we can engage members earlier, and even with our own substance abuse programs, we can connect those individuals to CalAIM. And so working with my director, who has over a decade of experience in substance abuse disorder treatment, he knows that the longer you can serve a member, the better the outcomes are going to be. So CalAIM has helped us to improve our members' lives, improve services. And outside of our historical services, CalAIM in general with ECM and housing navigation, those programs are so beneficial to the single adult population in California. Especially here in Kings County, we have a lot of great family programs at the local health and human services, a lot of funding to move people into homes, to reduce homelessness. And we've always lacked that single adult until CalAIM came in. And so it's a great service to add, and it really stays in line with our mission.
Thank you so much for sharing that, Anthony. It sounds like it's been a really nice addition. ECM and CS have been a really nice addition to the services that you were already offering members. We do have one question from the audience in the chat that I want to just acknowledge from Wiley. Anthony and Isabel, how are you connected to your local health systems and their patients in relation to CalAIM? Isabel,
Would
you
that
wanna
be
start?
You wanna
for
take that one, Isabel?
hospitals, clinics?
Wiley, are you able to come off mute and potentially expand on your question a little bit, what you mean by local health systems?
Yes, hospitals, inpatient, outpatient clinics would work as well. Thank you.
Thank you so much. Isabel, do you want to go ahead and?
Oh, Sorry.
That's okay.
I was trying to unmute. Yes, we do get that data information, and that's how we're able to identify some of our members and provide a member informing list for our ECM providers.
What was the question again? I'm sorry.
The question was, how are you connected to your local health systems? So meaning hospitals, healthcare centers, and their patients in relationship to CalAIM?
Really what Isabel said, we get a lot of information from a managed care provider, a lot of data that can help us improve our ECM services for the individuals. So we receive HIPAA information that we have to, be very careful with. And someone like Brenda, our enhanced care lead care manager, she used that information to figure out, when was the last time they saw a doctor, what kind of services are they getting, what kind of medications are they receiving. And then through our experience, we learned different websites and services that can help us understand health-related issues, and then reaching out to our contracted nurse and letting her know some of our barriers and how we can improve services. And so it's collaboration with data and medical professionals. And then we also have monthly MDTs, a multidisciplinary team meetings, where our contracted nurse is present and works with Brenda one-on-one. They discuss cases, how we can improve services, any barriers that we have. And so, and then also other CalAIM providers in the community are contracted with, here it's Adventist Health. And so they have a great CalAIM program that they're building up. So we work with them as well, sharing our best practices, and then also networking with them that can help us improve our services for the individuals.
Thank you both so much. Really appreciated. There's a couple more questions in the chat. I'm going to go ahead and get to one more. And if there are any that go unanswered, we will make sure that we revisit them and we get answers to our attendees. Sarah Nelson asked if you received any IPP funds, and if so, what did you use them for?
Sure. Isabel, did you want me to take over this one, or did you want to add anything before I answer it?
No, take it away, Anthony. Here are your funds.
Okay, so IPP was a fantastic grant. We applied for it early on. I can't remember if it was the first quarter or the second of 2022, but it was so changing for our program. It allowed us to do so many things and secure the program. So it allowed us to cover salaries. So we were able to retroactively cover salaries through January. We were able to hire a housing navigator. At that time, it was just me and then Brenda, who was an intern at the time. And so then we hired a housing navigator to take on housing navigation services and tenancy. We were able to increase our overall capacity, our caseload capacity, and our outreach capacity by having another navigator. And then designing marketing materials to help us grow the awareness of the program. And then attending different community awareness events. So enough salary to cover those events there. That really helped us by, like I was mentioning earlier, reaching out to the collaborative and different community resources. And so that was awesome. But something that's amazing for us and the agency was purchasing a vehicle. So the IPP grant allowed us to purchase a vehicle. It covered, I think, half the costs at the time. And so that helped us increase all of our outreach resources because our staff was using the one vehicle we had. So that was affecting the other programs. But I also have some notes here about the second program we applied for that they'll be talking about later, which is Cited. We applied for Cited and we got 100% of that grant, which was also, life-changing for our program and our members. So with Cited, we were able to hire even more staff, another housing navigator, 2 more navigators, and we have salary to hire another lead care manager. We're going to hire a full-time OA to help with a lot of the foot traffic coming in now with our clients. Our program is growing in the community, so it's getting a lot of awareness and people here. We provide a lot of housing services, case management services, so they're coming in. Covering any salaries that weren't covered prior with IPP. And then, let's see, what else do we do with the funding? We have funding that help improve our EHR system. And then purchasing a second vehicle, which is pretty exciting. And then some office equipment for our new staff, laptops, workstations, cubicles, cell phones. And then in case you guys want to do this as well, since we increased our staffing here at the entire agency, we're also going to repurpose one of our office rooms into a restroom to make sure that we're following all the guidelines with HR and providing restrooms for staff. So you can do a lot of great things beside it. So I definitely recommend reaching out and applying for that grant.
Thank you so much. Anthony, as I mentioned in the chat, our health plan just offered us the chance to apply for $3,000 in IPP funds, which is very sweet, but it sounds like you got a lot more than that. Can I ask how much you got in IPP and cited, if you're willing to share?
I don't know if they're still doing IPP grants. That'll be Isabel to talk about that one. That was a very early on capacity. We applied for a little under 70. We're a smaller agency, and our director's he does very good with strategy, and figuring out how can we best utilize those dollars. With SIDE, it was a bit larger. It was just under 400,000. So it just shows that growth there.
Yeah.
And so, yeah.
Thank you so much.
You're welcome.
Thank you so much. If we did not get to your question in the chat, like I said, please don't worry. We'll make sure to get responses out to you within the next week or so. I want to close out today by just asking each of you one more question. If you could summarize in a sentence or two, Anthony, what advice would you give to a CBO that's wanting to contract with an MCP who maybe hasn't done it before?
So I can give a little bit of, it's going to be more than a sentence or two, so I'll try to keep it brief. And the advice I would give is, if you are invested in the community, in your local community, you really want to improve the lives of single adults and some families, you definitely want to apply for this program. It's very flexible. It does sound very hard at first, but once you get the contract and you start working the system, there's so much support for you. So this is my first program I ran. It's a very difficult program, but even with me, I think it's been a great journey, and it's been a lot of support. You never feel like you're doing this alone. So some tips I wrote down for myself, and I will always want to share this in meetings, especially since there's going to be directors here as well, is understanding as a director manager, you want to trust your staff. So there's going to be people that are going to make mistakes. If you do your hiring right, you're looking for individuals that want to provide service, want to improve the lives of the community. Those are the people you want. So you want to train them as much as possible, support them, share as much as possible. Communication has been key for us. And again, like I said, allowing them to make mistakes and learning and growing as workers and improving the lives of individuals in the community. So, and just in short, I would say, go for it. It's going to only improve your community. It's been a great journey, and there's a lot of support.
Amazing. Thank you so much, Anthony. And I think we are going to close out there just so that way we can get on to some other things. But I know there are remaining lingering questions, so we'll make sure to get those answered and get those answers sent out to you in the coming week or two. Anthony, Isabel, thank you so much for joining us. This has been just so fruitful and rich. And I know that folks in the audience absolutely appreciated it. So thank you so much. And with that, I'm going to pass it back to Alexis.
Thank you so incredibly much, Emma, Anthony, the entire team, Isabel, Brenda. We just really appreciate, just like Emma stated, just all of the fruitful information that came out of this dialogue. This is what providers need to hear. I really like beckoning back to the Centering Care Conference that took place towards the end of last year, where we were just talking about the relationship building component and how critical it is to being able to move towards contracting and then successfully start to implement these services. And when we stated, CalAIM is hard, CalAIM is complex, it's something that providers have not done before. There was someone in the audience that said, yes. And that was that light bulb moment that we needed to go off for the rest of the participants as well, to understand that there are going to be some bumps along the way, but there are so many resources and support that are available to just make sure that we are pushing providers towards that contracting readiness and helping them support their communities. All of that being said, Eva, we can definitely go ahead and re-screen share so we can dive into some contracting best practices. This is just a perfect transition to carry us over from the dialogue that we just had to really break down not only the contracting process, but the best practices that can move you towards contracting readiness. And if we go to the next slide, we are going to reference a number of documents throughout this segment of the session. So we just wanted you to all have access to those links. Some of the documents that you'll hear us reference are the standard terms and conditions, the community supports and ECM policy guides, the non-binding pricing guidance. That one is incredibly important. Billing and invoicing guidance, the HCPCS codes, as you heard Anthony referencing earlier, not knowing, which codes to use, at first, but, having that support. We'll also reference the data sharing guidance and the quarterly implementation reporting guidance. All of this is a mouthful, and we understand that. And so that's why we just wanted to demystify this before diving into the contracting process and those best practices. So that way you're aware, these are the terms that you're going to hear. And DHCS has invested a lot of time to create these documents, but what we want to do is just translate them. So we're going to put them into just easier terms to digest as we dive through these best practices. Moving to the next slide. Before we go over the best practices, we wanted to do a very high-level recap of the contracting process itself. There are 5 high-level steps, and we have content on the HealthBegins website at healthbegins.org/CalAIM that actually has content that covers this entire contracting process. So any questions that you would have about this would already be available on that website. We have multiple session videos archived for your availability. So the first step is going to be obtaining an NPI. So before you can even dive into this contracting process, you just need a national provider identifier. It's just a 10-digit number that you would include on administrative and financial records that all providers must have. It's very easy to apply for. We've included the link for you inside of this deck. And you can kind of think of it almost like as a driver's license. You need a driver's license to drive, you need an NPI to provide services. After you obtain that NPI, you would just submit a letter of interest to the plans that you want to work with, that you want to provide those services to, and express your interest and your expertise in being able to deliver those services. As has been mentioned multiple times today on this call, the providers are the experts in rendering these services, but now they can get reimbursed to do so. And that's amazing. So after you obtain that NPI, you would submit your letter of interest to the plans that you want to work with. And then based upon that information that you include in that LOI, they'll invite you to submit a certification application. This is where a lot of providers have really needed support with navigating that certification process, making sure that they're validating their experience on that certification. And I'll dive into that later to explain how you can receive support with that, just as was uplifted in the session by Isabel as well, saying that they have staff on site to help make sure that that certification is being completed with support. After the certification process is or submitted, you would complete a gap filling process. This means you've submitted your application. The plan now sees that there are some gaps. Those gaps could pertain to billing systems, IT infrastructure, staffing issues, maybe some service gaps. Just making sure that before you go live, before you are contracted, that they have a very well-rounded understanding and plan that is in place to make sure that you're meeting all of the requirements of not only the plan, but of DHCS as well. And then finally, after you navigate that gap filling process, you negotiate your rates and you finalize your contract. And so we understand these are the high level steps and it's very process oriented, but what can you do to actually help you navigate that process? That's why we're going to dive into these best practices. And because we went over a little bit with our conversation at the top of the call, because it was so rich and so fruitful, I'm only going to spend about the next 15 minutes diving into these best practices. So that way we can transition into our breakout rooms to hear your reflections, process those questions, and just fill any voids that you may have for us. All right. So before we dive into our best practices, I just want to put a quick poll out there to ask everyone, where are you, based on our recap of the contracting process, what stage is your organization currently in? Are you obtaining an NPI, submitting an LOI? Are you going through certification, gap filling, or are you already in negotiations? Go ahead and submit a response to that. And when we have about maybe 50% participation, we'll go ahead and share those results. We see a lot of organizations are actually towards certification and gap filling and negotiations, so different from what we saw more so towards 2022, where everyone was still more so in that obtaining an NPI, submitting an LOI. We'll go ahead and just give that a couple more seconds. All right, so we are seeing A few that are still obtaining an MPI. That's great for us to know, so that lets us know where everyone is in the process. But we see that more so individuals are kind of like working towards the tail end of certifying, gap filling, and negotiations. Perfect. All right. And so we will go ahead and dive into the best practices. So starting off, the first best practice that we recommend is self-assessing your organization's readiness to meet the contracting requirements. And so diving into the next slide, how do you self-assess? What does that mean to self-assess? We have very comprehensive guidance provided for you inside of this slide deck. So I won't read all of the fine language, but at a high level, it means that you have reviewed the requirements. It means that you've reviewed the plan's model of care, meaning how they're going to administer ECM and community support services. You've reviewed the standard terms and conditions, which are the requirements that DHCS has presented for service delivery criteria, quality and oversight, data sharing requirements, payment considerations. You've also reviewed the service definitions. Although the providers are definitely the experts at being able to render these services, the definitions that you have for your services may not exactly line up with the way DHCS has defined the services. So just making sure that you're reviewing all of that guidance so you can have a clear understanding of the requirements. So when you submit your certification application, all of your ducks are in a row. After you've reviewed all of those service requirements, you want to assess your internal policies. So if there are requirements that have been outlined by DHCS that you see that your internal organization is not yet meeting, go ahead and establish those workflows or start to plan out those workflows so that way they can meet the requirements that DHCS is requesting. And when it comes to assessing those internal policies and establishing those workflows, we also have content for that for you online already. Next, prepare for reporting. DHCS does require that you collect minimum data elements from your participants, from your program participants. So are you collecting those data elements right now? More than likely not, because you have not yet participated in Medi-Cal billing, which is totally fine. So what you're going to do is make sure that you're also establishing the processes with your forms and with your workflows to be able to collect the correct data elements and prepare for the reports that your plan and DHCS are going to require on a monthly or quarterly basis. Another part of assessing your readiness is establishing the billing systems. You might not yet have the correct billing systems in place, and that's okay. So you're going to start establishing those based on the requirements that DHCS has. You're going to test those systems to make sure that they work properly before your go live date. And you'll also be able to connect with your managed care for their office hours, just as was mentioned earlier, to see if you have any questions regarding like how to submit claims, how the referrals process works, so on and so forth. And then lastly, we're recommending that you build workforce capacity. There are staffing requirements that are required as a part of the service delivery criteria. And so that is just another thing that you're going to want to self-assess. So as stated, the first thing that we're recommending is that you self-assess your organization. That includes reviewing the requirements, assessing your internal policies against those requirements, preparing for reporting, establishing those billing systems, and building workforce capacity. And we have content that is already pre-developed for you to review just in case this has not happened yet at your organization if you have not yet self-assessed. And in the interest of time, I'm actually going to go ahead and skip the next poll and just dive right into best practice number 2, which is determining which contracting pathway is going to be the best for your organization. We don't want providers to assume that the only path they have to becoming a provider is by going directly through a managed care plan. You also have the option to indirectly contract. Sometimes the billing requirements or the invoicing requirements or the administrative requirements might be a little bit too much for a smaller organization to take on. So they may want to ease themselves into CalAIM by instead subcontracting with another contractor that might take on those other administrative responsibilities. And so if we go to the next slide, you can see here that you have 2 options for contracting. You can contract directly with the MCP if you trust that you can build the capacity needed to be able to meet those requirements that we just discussed, meaning that you've self-assessed, you're confident, you know that you can meet all of these requirements, you can contract directly with an MCP. But if it feels as though the administrative and invoicing burden might be just a little bit too much for you as a smaller organization, you can contract with a different entity that would be able to take on some of that admin burden for you. And so if we go to the next slide, as you see here, just to do a very quick recap, contracting with the MCP requires that certain criteria be met, just as we mentioned earlier. That criteria requires your service delivery, capacity, data sharing infrastructure, your ability to bill, and ability to meet certain reporting requirements. And so that is what you would need to be able to meet if you're going to contract directly with the MCP. A lot of providers have already built the capacity to do this, and we'll get to that in the upcoming slides, how they built that capacity. But as noted, if we go to the next slide, that other option is available to you. If you don't have the capacity just yet to be able to directly contract, you can indirectly contract with a subcontractor. And just as an example of what that contracting entity might look like, it could be an FQHC, it could be a county agency. And what we've learned over the past year is that there are a number of providers that have never previously contracted with the managed care plan, but they have contracted with a county agency, and that process was pretty streamlined for them. So just to make sure that you, after self-assessing, you determine which contracting pathway is going to be the best for your organization. And if we dive into best practice number 3, once again, just in the interest of time, we can go ahead and just skip that poll because we do want to make sure we have enough time for our breakout sessions today. Going back to what Anthony was referencing earlier in the conversation, it is so important for you to leverage available funding sources to build capacity. This is something that we cannot stress enough. So I'll make sure I spend a little bit more time right here explaining what opportunities and avenues are available. So if we do a very quick recap, you have assessed your internal policies. You're looking at what policies that you need to develop in order to meet the requirements from the plan. Step 2, you've determined which contracting pathway you want to take, whether that be directly with the managed care plan or with a subcontracting entity. And now you're going to start leveraging those available funding resources. So if we go to the next slide, we've broken this down into 3 parts for you. So number 1, let's start off with PATH. PATH is the Providing Access and Transforming Health initiative, and this is supporting the implementation of CalAIM. DHCS understands that providers are going to need support, meaning financial support, not just the filling of the knowledge gaps and the relationship building, but also a financial component to make sure that they are able to participate in CalAIM. So resultantly, PATH is one of those programs that has been funded, and PATH has 4 funding arms. So Cited is one of the programs that Anthony mentioned earlier, which is the Capacity and Infrastructure Transition, Expansion, and Development Initiative. Say that 5 times fast. But essentially, what PATH does is provide funding for those providers that are going to provide services, so that way they can have those funds they can have that funding resource to give them upfront funding to build capacity, meaning that your program may not necessarily have to come out of pocket yourselves. You may be able to leverage these funds in order to build the capacity to meet the service requirements, to meet the building requirements, to be able to meet the IT requirements. This is available to make sure that you can hit the ground running. So you would be able to click the link that's inside of this slide deck to submit an application for those cited funds. There's also a TA marketplace. The TA marketplace is essentially a virtual one-stop shop where you would be able to request technical assistance. This can be hands-on technical assistance. It can be off-the-shelf technical assistance, meaning that it's pre-designed modules that will help you navigate CalAIM contracting and implementation. So in addition to you having those startup funds that you can use to leverage the cited bucket of funding for, you would also have the TA marketplace that you would be able to leverage to receive hands-on one-on-one technical assistance. In addition to the TA marketplace, collaborative planning and implementation groups have also just launched. So you have questions, you feel lost, you're uplifting various challenges that your organization is facing, whether it be in the contracting process or in implementation or in building stronger provider networks, so on and so forth. You would be able to join a collaborative group, and your seat in that collaborative group, in that work planning group, would be fully funded by the PATH initiative. And then lastly, which I won't dive into today, just in the interest of time, would be that justice involved group. There's also a bucket of funds that are available for providers that are supporting individuals that have been previously incarcerated. And so those are the 4 buckets of the PATH funding arm that you would be able to leverage to make sure that you can build the capacity needed to participate in CalAIM. You might think to hear that many initiatives is overkill, but we know based off of our experience over the past year that all of these different types of support and resources are needed to just make sure that we're supporting providers in the way that they need to get supported. So that was part 1. Part 2, you're going to review IPP funding opportunities. Once again, as noted by Anthony, he was able to tap into his managed care plan to apply for those IPP funds. And providers can apply for multiple rounds of funds directly through their MCPs through 2024. So you would be able to tap into your managed care plan directly because the state issues those funds directly to your managed care plan, and they can be used for a number of things, as Anthony mentioned, in addition to having a consultant support you navigate the certification process. So there are various things that are in place right now to just help you move forward in this process. And then lastly, which is very, very important, you'll see at the bottom of that slide that you will need to have a signed attestation. The reason why we're uplifting this is because cited and IPP funds are for contracted entities, meaning that you are providing ECM or community supports services. However, because we know that those upfront funds, or because DHCS, knows that those upfront funds are needed to build capacity, you can receive a signed attestation from your managed care plan to say, this provider is interested in becoming an ECM or community supports providers. They're navigating the contracting process and are more than likely going to become a provider. So we attest that they are going to more than likely become a provider, so that way they can have access to these upfront funds now to help them build the capacity needed to launch their programs. And then if we go to the next slide, we just created a very simple chart for you to kind of see how that funding ties into the application and the certification process. So as we noted before, you'll apply for that, you'll apply for your MPI, submit your LOI in your certification application. Then you'll go through the gap filling plan, and then you can use cited and IPP funds to build the capacity that you need to meet contracting requirements. And we can move into our last couple of best practices. So diving into best practice number 4, we can go to the next slide. Something that's very important is to review the non-binding pricing guidance. We've heard mixed feedback from providers that they were under the impression that the guidance was required, that they couldn't negotiate their rates. You can absolutely negotiate. Just do a very quick recap. At this point in the best practices process of navigating CalAIM contracting, you've self-assessed your organization, you've decided to contract, and you've leveraged funding opportunities. But before moving into negotiations and finalizing your contract, like I said, we just want you to review the non-binding pricing guidance, and the deck that you've received in the chat has a link to that guidance. And if we go to the next slide, at the top of the call, let me back up one slide. Oh, Ev, I'm sorry. Let's just back up one slide. Perfect. There we go. At the top of the call, we uplifted that the contracting process included getting an MPI, submitting an LOI, submitting a certification application, completing the gap filling process, and negotiating rates. So after you've completed that gap filling process, the MCP is going to develop a contract for you to review. And when you review that contract, this is where the non-binding pricing guidance comes into play. So you're going to review the contract, you're going to ask clarifying questions, provide any edits where it makes sense for you and your organization, and you're also going to need to respond to the rate that they have proposed. So when you are requesting a rate increase, which is totally fine, you just need to justify those costs because you know how much your program costs. And so the non-binding pricing guidance is going to help you justify those rates. And so now if we go to the next slide, we've included exactly how the non-binding pricing guidance helps you calculate and justify the rates. So for example, you're going to have costs that are related to service offerings and capacity. What are the associated costs of you administering that program? Particularly, what are the costs of administering that program in alignment with the requirements that the plan and DHCS have set forth? What are your staffing models? Are you going to require subcontractors? What are the infrastructure costs? What are the costs of data storage systems? So on and so forth. So within the non-binding pricing guidance, you're going to see a list of considerations with recommended rates, and you would be able to use the information that they have included inside of that guide to calculate rates appropriately for your organization. And then if we move into our final best practice, which is the most important to bring everything that was discussed previously full circle, please build relationships with CBO peers and managed care plans. CalAIM is a multi-year, long-term initiative to advance health equity. And so we want to strongly encourage you to cultivate those relationships, uplift challenges, ask questions. The conversation that we were able to hear between Anthony and his managed care plan was one that was solutions oriented. So we don't want you to get discouraged from participating in CalAIM because you do not have the questions to your answers or the answers to your questions from the onset. That's okay, because most providers have not had experience with Medi-Cal billing. And so all of that being said, we want to give everyone an opportunity to ask questions, to uplift any reflections that they have had. And so we're going to very briefly cover our key takeaways. If we go about 2 slides up, Eva, we'll just cover our key takeaways from this part of the session, which are to leverage these best practices to successfully navigate the CalAIM contracting process. So that first step was self-assessing your organization's readiness, using the guidance that we provided inside of this content to determine the best contracting pathway that's going to work for your team, to leverage funding resources, to comprehensively assess the non-binding pricing guidance, and to build relationships with MCPs and peer organizations. That being said, we are going to go ahead and break out into these breakout rooms based on whether you are still determining whether or not you're going to contract with CalAIM, or if you are going to, or you're already in negotiations, you've already submitted your certification, and you have questions about that process. You can also uplift any reflections that you have and questions that we need to fill during these sessions as well. So you'll see a couple of options in just a moment for those breakout rooms, and you will be able to join the room that is most reflective of your needs. And we will see you in those rooms. I previously discussed with Emma, sometimes we dive into the conversations and always forget to assign someone to report back. So from Group A, is there anyone that wants to just share back to the room what y'all were able to touch point on? We're Group B. And Sarah, I'll take that as volunteership for Group B.
Oh, group I was on.
But yeah, for Group A, is there, or Emma, did you want to report back on just a few things that were touched upon?
I'm happy to. We did exactly what you said and did not identify anyone. So I want to
knew it was going to happen.
give some space if anyone who was in our group wants to chime in and speak about what we talked about. Okay. Well, I'm happy to share just very briefly. A lot of the folks in Group A are very new to CalAIM. And so we were talking a little bit more around clarification around the PATH funds that you described, Alexis, as well as ECM and community supports and what would be considered eligible for reimbursement. So we were really just talking about some of those kind of baseline components of CalAIM to gain familiarity, and then talking a little bit about what next steps might look like in terms of gaining more information and potentially heading that route to contract with an MCP.
Perfect. And then just for all of those providers that were in Group A, we do want to remind everyone that, as I stated earlier in the session, we do have all of that content available for you, so that way you can better understand the contracting process and be able to review that contract step by step. Our partners at Aurrera Health Group were able to design and facilitate some amazing content that would really just help providers understand exactly what those steps were going to be. So that way, if you're making that decision, you'll know what considerations that you would need to have, and you will be able to leverage those best practices. And then from Group B, I believe we had Sarah.
Hey, so Group B talked about a few different things. We talked about what happens when the contracting process is not going the way that you wanted it to go, and what, how to work with health plans in sort of the long term to get to where you want to be. We talked about medical data and reassured all the CBOs that we do not have to collect medical data. That's not our responsibility, thank goodness. And we talked about billing and invoicing, which is everyone's favorite topic, and who's doing in-house billing, who's using clearing houses, something I'm very interested at the moment, and how to develop streamlined processes for invoicing and billing. And Jill shared a link in the chat about billing and invoicing that now you can all enjoy.
Thank you so much, Sarah. And so I think that's something that was really amazing for me personally to see today, was that the level of specificity for the questions that we had in Group B was getting close to some of the most specific questions that I've seen over the past year, which was wonderful, because if there are answers that I don't have, that's great, because it means that our providers are moving along in the process. And I hope that that really serves as motivation for the providers that were in Group A to know that you will one day be in Group B as well. All of that being said, we can definitely go ahead and screen share, starting off on about slide 37. Eva, if we could screen share slide 37. And give us just a second on this end. We just want to give everyone some really important next steps as we close out. Thank you so much. All right, so as I stated at the call, I know that everyone is over capacity these days. Life is crazy, work is crazier. And so we just really appreciate everyone joining us today. And we really hope that some of the information that you were able to take away just really helps you plan out what the next 30, 60, 90 days is going to look like for your organization and your progression within the CalAIM landscape. Regarding our next steps, there are two very important next steps that we wanted to identify today. So if we go to the next screen, you'll see that there is going to be a Path Cited webinar on March 3rd. This is going to be for the second round of cited funds. DHCS just announced that $119 million was awarded to 98 organizations for round one. So for round two, to participate, to apply, please, please, please register for that session. We've included in the slide deck that everyone should have access to right now. And Melissa has also just dropped it in the chat for us, so that way you can see that link and register for that webinar that's going to take place on March 3rd. Secondly, the TA Marketplace is now live. Earlier in the conversation, we were referencing all of those funding arms that PATH has established to make sure that providers are being supported throughout multiple domains of support that's been requested. The TA Marketplace is that arm where you're going to be able to request technical assistance, whether it be hands-on TA, one-on-one with you and a consultant, or TA that you can just download off the shelf, from the TA Marketplace. To be able to receive content that's pre-developed. In either instance, please go ahead and click on the link that we provided in the slide deck for you, so that way you can access the TA Marketplace, which will then connect you directly with DHCS to just screen your application and determine exactly what your needs are. If we go to the next slide, Just as a reminder, all of our presentation resources are available on healthbegins.org/CalAIM. You would be able to review not only this recording, but all of the prior session recordings that we have as well for both statewide and county specific sessions, if you just so happen to operate in any of the counties that we provided technical assistance in. And then we just want to give a very brief but very special thank you to our project partners, which includes our HealthBegins project team, the JSI project team. Emma, thank you so much for steering that conversation today. Aurrera Health Group, Transform Health, and Mount Auburn. A lot of entities have come together to just make sure that we are providing you with the most relevant and the most up-to-date information to help you navigate CalAIM contracting. That being said, thank you all so much, and please email us if you have any questions whatsoever. Thanks, everyone.
Thank you.